Welcome to the DrFrankenSteve podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is the DrFrankenSteve podcast. I'm your host, Frank Williams, and this is Dr. Steve Snodgrass. Today's topic is going to be on mental health issues, causation, some stats, and then different things that cause these issues and where you can get help, and actually some things that may help you cope with it. And it'll all tie in towards some of the things that Steve and I are doing and working with right now with hospitals, with art therapy also. So without further ado, I'm going to let Steve take his part, and as usual, I'll jump in and then I'll start giving you my boring stats and then talk about some of the ways that you can get help, seek help, and just some very interesting information. You might find it's boring, so you can always watch this if you have an insomnia. So
there you go. Well, for me, we'll welcome everybody. But the thing about it is that when we choose a topic, you do your research, I do my research, and for the most part, we don't talk about what the other one has looked into, because it's kind of like, well, we'll see what spontaneity will result, that sort of thing. And this one is a really like a widespread topic, and it's a dangerous topic. And I took a little bit of a different direction than probably what you did.
Yes.
But so I can kick things back here a little bit, because what I did, we're going to go over all these things about anxiety, depression, and all these young people getting put on all these psychiatric medications, which is just like, it's beyond comprehension.
It is.
I mean, it really is. And I took, like, if you take that whole big pie, I took like a sliver of it, but it's a significant sliver. And it deals with the hormonal birth control. And the reason that I went that route was because I was telling my wife, hey, we're going to be talking about medications and psychiatric drugs and all that sort of thing. And my wife is a clinical pharmacist, and she has over 2,000 patients. And as you know, scope creep was our first thing, right? But I'll say this, my wife has over 2,000 patients. She's devoted her life to doing this. And she not only works hand in hand with physicians, she lectures physicians. So, this is completely out of my field in regards to general vascular surgery. When you go into like the whole OB/GYN and all that sort of thing and dispensing out these kinds of medications, I never did that. And I never did that for a great reason. So I had no interest in it whatsoever. But it's an incredibly significant problem that affects a lot of people. And I don't want to get into, this is going to be almost like two podcasts, 2 for 1. It's a twofer.
It's the fall. It's sale time. It's 2 for 1. Buy one, get one, whether you want it or not.
Yeah, it's like, hey, you can always just turn off the channel. But I think there's going to be a lot of information that's going to be extremely useful, and hopefully, our goal is to stop some of this.
Right, and let people get help, and to whatever they need. Hopefully, it's for a season. Like my PhD is in the art of warcraft. It's got nothing to do with this, even though there's psychological, theory in that. It's a little different than what this is. So we're just, like I said, Steve he's an MD. I'm a PhD, and ours are out of these fields, even though his is a lot closer. But I still think anybody that looks around, talks to professors, talks to teachers, talks to youth counselors, and just watches the news, it's an epidemic anymore.
Yeah, and I've been reading about this whole thing on like PMS and all this other kind of stuff. So like, Warcraft might be a good PhD.
It's only if you get in their way.
And so sorry about that, but it's just like, and then I realize it. And I used to like, sure, because I dealt in things like that were so inarguable. I mean, somebody comes in with a ruptured aneurysm or a gunshot wound or stabbed in the abdomen or bleeding to death or a car wreck. It's like, you're not going to sit there and argue with me on what kind of medication they need. It's
Right.
like, you know, they need surgical steel and they need it now. So I didn't have those kinds of issues. So all of this just kind of like is new turf to me because I haven't done OBGYN related material in forever. I used to have to take months of training in OBGYN as a general surgeon. There's a lot of OBGYN training that you do. And I mean, the fact that those guys and women, they're so busy, and the fact that they've got like the practice of delivering babies, doing hysterectomies, there's ovarian and uterine cancers they have to deal with. And so their time, they are stretched so thin that when somebody comes into their office and complains of, oh, well, I've got this and I've got that, and you know, all these kinds of different problems, are going like, sure, let's just kind of like take care of you and I'll write you a prescription and we'll go on. And I can understand that because it's like you are so overwhelmed with procedures that you're just exhausted and you listen to those complaints, and we're all human. And
Right.
you know, you're just going to say, well, I can fix that with a prescription. And a lot of times that's what's being done. And no one is deficient in Zoloft or Prozac. That's not a body deficiency. So it's like, that doesn't treat the root problem, which I'll get into. But before I get like on a major rant, I'll let you go on yours.
Well, mine is more, you know, the amount of children, elementary school through college, that are, you know, having mental health issues, the amount of them that are on mental health medications. This is not information from direct sources from the people I teach, because I do teach some doctors who are in the mental health field. And we discuss the overall and general population and, you know, how it's affected, and from everything from since the you know, the 90s until now, since the early 2000s, you know, you've got about a 50 to 60% increase in the amount of students who are on actual psychiatric medications for anxiety, depression. There's a myriad approach right now to say, okay, we're going to give them some medication, as Steve said. And I know MDs, even MDs that I'm friends with and are trained, that said sometimes they come in and the best thing to do is to try and get them settled down. And it's not they're going against their Hippocratic oath. They're just figure that they can't find anything else wrong. If they're going through a slight bout of depression, anxiety, you know, whatever that might be, then it's better just write a prescription, you know, for a short time. They can put them on a mild dose, see how they do. The problem you got with some of those drugs is relatives that I have seen, when you get on certain medications, it can kind of zombify a person. And then, you know, they get these, you can have all kinds of side effects. And that's why I tell people, make sure you research this stuff, because you can have suicidal side effects, depression, withdrawal. There's all kinds of things that are out there. But looking at just like, I'll cover school age, meaning elementary, children 5 through 11, 12 through 17, you know, and the amount of, or rather the statistic on the percentage of those all the way through college, because college is, you know, that's really a big area where mental health seems to be increasing exponentially. And there's a lot of social burdens on that, because they have, you know, success anxiety. Are they going to be able to graduate? Are they going to pick a field that they want? You know, are they going to be able to accomplish what they need to accomplish? Their social environment, all of these things. Money may be a factor. So all these things are coming into play. And currently, I'll make sure, because I just printed off some brand new statistics that came out.
Well, let me just interrupt you for a minute. Sorry to do so. I may be old school, but I might just be old. That might just be it. Yeah. But it seems to me like and this is one thing I really do. I have fear and anxiety about this, and that is like, if you have a kid and I've got a new grandson and all that sort of thing, so I always just think about him and what his life's going to be like and all that sort of thing. And it's like, there's so many letters. There's ADD and ADHD and there's this and that. And so it's just like they're labeled.
The acronyms like RE and RE.
Exactly. I mean, they're labeled, you know, and so, and being labeled early in life as having some sort of issue, then that carries a lot of stigma with it. And so I'm not telling anybody not to get help or treatment, but I'm just like, be sure that you are seeing a qualified person to do it, because, if you get labeled with some sort of thing, that's going to stick with you. And I know everybody's saying like, oh, are you against seeking psychiatric or psychological help? No, I'm not. Please don't misconstrue the whole thing. It's just that when you're put down with a label, that carries with you insurance, credit checks. I mean, all kinds of things come into play on a label that you receive, whether you may deserve it or didn't. I don't know. But like
These are incredible though when you look at them, because according to NIH, the CDC, who keeps up on all these, there was a study in 2021 that said it's about 22% of all children, and then nearly on another survey and statistic, about 1/3 experience poor mental health to the point where they need counseling. And then, that goes by gender, goes by ethnicity, all this. So, basically children's mental health, it states that about 1 in 5 will be diagnosed with that's 20% by a mental disorder by the time they're 18. And out of that, about 21% usually come from low-income families. 50%, are usually on the welfare system or on some type of assistance. And then I think that's incredible. When you look at even, the sex, when you're talking about getting help and needing help, boys are more likely to take mental health medications than girls are. And I don't know why that is, but that's just, just a factor. The biggest issues you have right now also is that, increasing by 50%, this is becoming a global problem, not just here, because other countries are facing the same thing and I'm just talking about elementary age kids, and I'll get to the college age ones, but Australia is pretty close to the US, and now they're finding that UK and Europe are starting, and it's about 7% growing to about 10% around the UK and Europe for finding that elementary age and children are starting to need to be on medications. So when you start approaching 10% of a population, that's a big number.
Oh, yeah.
When you start approaching 29%, 30% in those areas, that's a huge number. And those children, God bless their parents, because they're trying to deal with the situation. The parents are stressed out. It can cause financial harm because the parents are trying to get them treated. If the insurance only pays for so many insurance visits for a therapist, depending on what therapist you get, then there may be medications that are not covered, co-pays, all these different things. And these poor kids are walking around, half the time there's a percentage of them that won't even seek help. They'll just keep it to themselves, which is unfortunate because, suicide is becoming a major problem also. It is in a lot of different areas. Like, I'm big on the veteran suicide thing, so there's some great groups out there, and the medical community trying to help with that, and the psychiatric community trying to help with that. But with children, that's really pulls at your heartstrings, because that's a horrible thing, basically. And so what we want to do is make sure, if you're under any type of stress, with all joking or cut up aside, if you're under any type of stress or any type of crisis, or you're just starting to feel things, you don't even want to talk to your parents, you can call a number 988. Is just like calling 911. It's a crisis, it's anonymous crisis counseling center and suicide prevention hotline. So that's for children, that's for adults, that's for college age, because really, even the Mayo Clinic is saying that this is becoming an epidemic. And I mean, they've got several studies out that you can look at. And they've got some things that the Mayo Clinic and the National Mental Health Institutes and all that suggest that people do for these. And we'll get into some of those as we get down the podcast here, but not to bore you anymore, like I said, but I've experienced it, not me personally. And I was, I know I'm a little out there.
I was going to say, that could be debatable.
Yeah, there's no medications that'll help me. As my wife says, it's like the old young Frankenstein. Abby something, Abby normal. That's okay. I love it.
Yeah.
Eccentric's another word for that. But
I've been called that.
Yes, I know. A little earlier today, probably. When was the last time you talked to your father?
he calls me all kinds of different things.
Yeah, I'm sure. But there are a lot of programs that people can seek them out, not just through counseling at school. And I will let you know, like I said, my relatives, I've seen them put their kids on certain medications, and just like I said earlier, they'll be zombified. And then when you get to the school, I experienced this with my oldest daughter. When she was very young, she was in kindergarten, and then she was in first grade. And she's a social butterfly because she's in English, she's got honors in English through college and everything, and she's an editor and producer for a large news outlet and been Emmy nominated. And so, but when she was very young, she was very social. I don't know where she gets that from, being an extrovert, but she was very social. So her teacher would continue to call us, and I'd say, you only have her for like 4 hours a day, and you have her 3 days a week. Well, your daughter's being disruptive. I'm not going to, because the teacher was, probably needed to be somewhere. I won't make fun of professions, but she didn't need to be in teaching anyway. So I go in there, the counselor meets with us, it's very serious, and says, I think we need to get her on a regimen of medications. My wife's with me. Now, we got brand new babies, and then Marissa is, just started school because the twins were, newborns. So I go in, I'm listening, and this teacher professes, we have watched her not be on task for long periods of time. This teacher's going on, the counselor, who mind you is nothing wrong, because I know some licensed counselors, is a licensed counselor, tried to come across like she was a psychiatrist. I said, well, are you authorized to recommend and write prescriptions for the medication you're talking about? I am not. I said, so I'm going to ask you a series of questions for both of you, because let me respond in the following way. What tests or observations do you have logged that can help us as parents to discuss with her? I said, does she not do her work? She gets her work done quick, but that's the issue. Then she wants to talk to her friends or, go with a friend. I said, okay. I said, well, give me the example of we just tested this morning, is why I'm calling you. We had a fire alarm, and I observed her over a 30-second period. Yeah. She said she was on task for 10 seconds. She was off task for 15 seconds, and she was back on task for 5 seconds, which tells you 50% of the time she was not paying attention, not on task. So I started to enlighten them about how I'd worked with children for a long time, a couple of decades at least, as I said. Children behave differently, but we can't stifle them, they have to behave. But it was a minor thing, and this all of a sudden to go from that and say, well, that's kind of what happens sometimes when, if I'm saying, okay, let's line up for the playground, she'll get off task. Or if she gets done early, she's off task. But she always gets her work done. Okay, maybe she's not challenged enough. But to set and recommend that she immediately go on some type of, what was it, Ritalin, I think was?
I'm sure.
Yes, yeah. And that, and probably start with a dose of, and I thought, and so I made a complaint and said, one, I don't want my daughter, so we had her moved out of that class. And then two, I made a complaint saying you can't be practicing medicine without a license. I don't care what you are. Like I said, I have friends that are psychiatrists and psychologists, and the psychiatrists are MD, so they can prescribe medicine. Those are the only ones, that my understanding. And so even that, they try and be leery of children that young going through that. Well, of course, she worked herself out of it after a few years, but she was always a social butterfly. She loves to make friends. She's so tender-hearted. And so I just remember that vividly to this day as we were going through this, preparations for this podcast about, sometimes children can be labeled, as you said, Steve, and there's no need for it. It may be, it's not that it's even a disciplinary problem. Maybe they're not being challenged, their creativity is being stifled, and you don't need that. So for the parents out there, if you're hearing stuff from these schools, don't necessarily believe them. Get an actual second opinion and go and have them, if you want to have them tested. Because we did, on their advice, the first time I had her tested, and they said she don't have ADD, she don't have ADHD, she don't have any of these. She's just a sweet little girl that just likes to be friendly. And I said,
Well, I mean, to my point, I mean, see, like, if she would have gone the other route, I mean, if you all weren't caring parents, and she went the other route, and like all of a sudden she's on medication now, and she's been labeled. She's been labeled. By the way, that's a very short leash, 15 seconds or whatever. I mean,
that's what I said.
Lordy, that's a short leash. But that to me, again, I'm not saying if there's a problem, don't get it checked out. I'm not saying to ignore the problem. But what I'm saying is pay attention to every step of the way, because along the way,
don't create a bigger problem, a future problem.
Yeah, you're going to get labeled potentially with something that doesn't even apply to you. And if that's the case, I mean, you can suffer from that for the rest of your life.
Oh, it can affect you down the road if you have to have security clearances or
anything.
Or jobs or anything else. So that's why I agree with you 100%. You got to be careful because, here's a couple, and I don't make fun of anybody because I'm, a big supporter of teachers and counselors because they have a rough job. But those two were a couple clowns.
Well, you know what? They call Forrest Gump stupid, and look at what he did.
And they called Elon Musk.
Yeah.
He'll tell you, little Riri, but he's also, worth a third of $1 trillion. And
well, I mean, he's done well.
We wouldn't have there's some places right now that they call on him, much as they hate. A lot of people hate him. They're calling on him right now because of the devastation going on from the last hurricane. He's supplying the internet through his Starlink system.
Yeah. Well, it's one of those things where it seems to me like it's never been more of an issue than it has been now.
Right.
And I mean, you didn't see all this stuff when I was growing up, or when my parents and my grandparents. I mean, these kinds of discussions really, there weren't too many of them. If you just didn't see it. Maybe one or two kids out of the whole school or something had some sort of issue, but that was about it. And from there, it just seems like it's blossomed into an entire new industry.
Well, I was just going to say, I bet you, and I didn't look in the total amount of money, and I was going to, and I said, well, I'll say that sometime we go after Big Pharma and all those on one of our podcasts. But you can bet this has to be in the hundreds of billions of dollars, this industry, if not the trillions of dollars.
I mean, it's going to be a moneymaker, and it's going to be exploited. It's going to be exploited, and at who's going to pay? Not just money, but who's going to pay for the look at the psychological cost and the physiological cost of it all. I mean,
the continuum of care.
Yeah, and so it's extreme. I'll put it this way: if someone ever referred to my children as problematic or anything like that, or my grandchild, they've got me to deal with. And
they may be on medication themselves.
I'll put it this way: I will make it a personal mission. I'll make it a personal mission. I made it a personal mission with my younger sons. Just going like, if anybody does this or that or whatever, I need to know quickly and decisively. We will come up with a plan. But it's you've got to have. How many times have we talked about on this podcast about being an advocate? Yes, I mean, and it's just like you have to be your child's advocate.
Well, if you get on medications and you think you see a difference, but it's just maybe the child or the adolescent or the college is working out of it, and though that season of time that was causing that stress is over, you got to remember as parents, your children, if they're in college or living with you in today's socioeconomic times, because of everything, high interest rates, housing non-affordability and all this. If those children of yours or dependents are with you, currently at age 26, they're off the rolls of your health insurance. But if they've been under some heavy duty or some medications, you're not going to let your child stop taking medication at 26 when that insurance stops. No. If they can't get, or they don't have insurance, or it's so expensive to have that, and they're relatively healthy other than that, it may come down to you as a parent forking out that money, for those drugs that your child's on.
Oh yeah.
Even though it's an adult child, you're not going to let them suffer, so you're going to buy it. So that can create a little hardship on parents who are basically empty nesters that are, have worked their tails off to try and get to that point and now can't.
Oh yeah. I mean,
and it's not because of the money. Don't take that wrong, like Steve said. Our whole thing is causation, prevention, and the different things that are out there to maybe help with this. Because I've got a podcast I'd like to do down the road on victimization. And I think the U.S. especially, I'm going to say this, I can edit it out later if you want. I think after 9/11, and I've got a whole little thesis written on this, we went from being a nation of, and that was President Bush's time, we went from a nation of, we're going to stand up, fight back, we're not going to be a victim. It changed to becoming, oh, I've been victimized, I have a right to retaliate. I've been victimized, I have a right to seek refuge and safe space. Nothing wrong with that. And to where I'm looking for a way to be a victim, I'm looking for a way to be offended, and what can I get out of it? That was my little rant.
Well, for me, like, let's just say I've kind of come up with a thing that I say to myself a lot, and I've said it to my kids, and that's the thing. And truly, I think I personally like it a lot. But if you're going through like a really hard time, and they're never going to stop. They never stop. They just never stop. It's always something, as Gilda Radner would always say. It's always something. But it's like if you're not on any kind of medication, but you're facing challenges in life that are extremely difficult, which we all have. But the way I look at it, I've got to say it, because I love the whole history of World War II, to look at that and how people reacted and all that sort of thing, which is really a study in humanity like no other. And it's just like, I always say, it ain't Normandy. It's like, you know what?
Yeah.
It's like, well, I've got to go do this case, and this is going to be an extremely difficult case with a lot of odds against the patient, all that sort of thing. And you just have to be perfect in the OR to give this person a chance. And you think like, oh gosh, can this really get done? And I just look and just say, hey, it's not Normandy. You're not going to be coming off that boat, and all of a sudden, people are just shooting at you. So whatever it is, you can work through it.
And he's not saying mental health isn't, because mental health, I'm a big proponent of the Second Amendment, but I'm also a big proponent of there should be some type of national database for mental health issues. If you've got someone that's, could be dangerous, is dangerous, you should not have weapons in your house easily accessible or anywhere around that they can get a hold of it. I think when you go to buy weapons, I think that just like they flag you for felonies, there should be and I'm a huge proponent of being a retired law enforcement and a former U.S. Army. But I think that mental health, I've seen it, and I've experienced it with friends and people that I'm acquainted with, and had to go and check on people and search for them that had mental health issues but got a hold of a gun. So it's a serious situation, and we're not making light of that or taking away from it, but at the same time, as Steve is politely saying, there are certain times when, if you can get to the root causes, you can settle those issues. And we're neither one of us are psychiatrists, but I'm telling you, there's a lot that can be done to prevent these medications, because that's just the easy out for a lot of people. As I said, I experienced it in my own family, and it's just ridiculous.
Yeah, well, I'll go back to this birth control thing, and I just I look at it with all these. It seems like any kind of complaint or anything like that, it's going to warrant you're getting a prescription for the birth control. And again, I listened to this 14-year-old girl. I listened to her video, and it was so telling, because she's saying like, well, all my friends were on the pill. I wanted to be on the pill. And she said there was nothing wrong with me, but I went to my doctor and said, like, I just want to be on the pill. And so she got put on the pill. And she had this thing to the point where she was so erratic, if you will. She tried to drive her car into a tree and kill herself and her boyfriend. And once she got driving age, because she'd already been on the pill, for a couple, 3 years, and had been experiencing all these different problems, and they were just kind of just shoved under the rug. And so it's really something that, even though it's on the package insert saying like this can cause mood swings and problems with psychological issues, it's like, well, the prevention of pregnancy or whatever you're complaining of, that supersedes.
And they use it sometimes for other things too, don't they?
They use it all the time. They use it just like, you go in and complain about anything, and especially any kind of menstrual cycle irregularities, or even acne or anything.
That's what I thought. I heard about it for acne.
Yeah, they'll just prescribe it. And there was a study done, and it was really quite remarkable. It was published in JAMA Psychiatry, in Journal of the American Medical Association, and it dealt with over 1 million women over a 13-year period. So that's, that is quite a time, for a study to go on. But it was dealing with women who were 15 to 34. And so many of these women were put on antidepressants, and they finally concluded that, look, any person that's on this hormonal birth control, they are susceptible to having deeply problematic psychological issues. And so this should never be just swept under the rug and just be dealt with by writing a prescription for Zoloft or Prozac or something like that. It's like, you've got to get to the root cause of this. And the issue too is there's so many things where they have interactions in the brain and the central nervous system. And so a lot of these people are put on hormones at 14 years, 12, 13, 14 years old. And the brain is not fully developed until you're in your 20s.
Right.
And so like there's this, they just call it like an open window. And like whatever that goes through that window, the window closes later in the 20s, but whatever goes through that window, that's going to determine your psychological makeup for the rest of your life. And so some of these drugs that you're receiving, these synthetic hormones, can have ramifications that are lifelong. And that is just a terrible potential problem.
It is.
Yeah.
It sounds like that's a horrible thing. And just for those who noticed, since we did a podcast on plastics, this is all the studio had in here was a plastic water bottle. So I'll have to take that next time to make sure I bring my water can.
Yeah, well, it's nothing like practicing what you preach.
I do. I had my water bottle. I've had about a gallon of water today, and it's in my big steel water flask, and walked out, just forgot it, trying to make sure I can deal with the mental health issues.
It's the way life will do you sometimes. Yeah, it's the way life will do you. But back to this pill thing, the sex steroids, they will increase the activity. I like to get into the science of it. Mm-hmm. Now, that may be boring, but it's like, I think one thing about our podcast is that we do kind of delve into the, well, why does that happen? It causes that, but no one really addresses the why. And so they will increase a level of monoamine oxidase. It's an enzyme. And where that comes into play is that it will lead to further degradation of serotonin, which is like the feel-good neurotransmitter. So you're having depletions of serotonin levels. And so that can lead to all kinds of issues. I mean, this is what was listed, involved in mood, cognition, the reward system, learning, memory, sexual activity, feeding, sleep, temperature regulation, and reaction to pain. I think that kind of gets it, doesn't it?
Yeah,
I'd say that kind of takes care of the day for you. And also, tryptophan is an amino acid, and as well as tyrosine. But the pill will disrupt the tryptophan pathway, and when it does that, it can lead to depression. And so, and really, this suicide thing is so real because in that study done of 1 million women, it increased the rate of suicide significantly, and the rate of suicide is increased within the first 2 months of being on the pill. Oh, wow. So you really, and it can last for up to for years later. So you can get off the pill and you can still have some suicidal ideology. And so I had no idea that it had gotten that bad. But when I listened to that 14-year-old girl and she was talking about her symptoms, and it's like, it got so bad, and I was arguing with my boyfriend, I just tried to I just sped up and just ran my car into a tree. It was like,
so don't take her to a shooting range.
Hence the Art of Warcraft PhD could come in handy.
Yeah.
It's just like, well, maybe
are
you all right?
Car while it's rolling, yes.
Yeah, it's like, hey, next time we go out, I'll drive.
Yeah.
So, it's really, and the other thing too, I had no idea about the nutrient depletion associated with taking these hormonal contraceptives, because they have found, and I think the mechanism is that the metabolism has changed. When you give somebody synthetic estrogen and progesterone versus their own natural hormones, it speeds up metabolism, so it changes the metabolism. And so you get depleted of B vitamins, and that can lead to disruption of the tryptophan pathway, which I discussed. Also, it can result in, it's called GABA, aminobutyric acid. It's an amino acid, or GABA, and that's an inhibitory, has an inhibitory function on the brain. If that's released, then you're going to be anxious. And so that's what leads to all the anxiety. And so that's associated with it. And antioxidants like vitamin E and vitamin C are depleted. And that could result in free radicals disrupting the whole neurological health. And magnesium, along the same way. Magnesium, a lot of people are low in magnesium in their diets because of soil concentrations and just what's in the food. And when magnesium is depleted, you can certainly get all kinds of different problems like hypertension, blood sugar problems, constipation, headaches, migraines, depression. So it's a very real thing. And also selenium and zinc can be depleted, which have to do with thyroid function. And it also diminishes or increases thyroid binding globulin, which takes the active thyroid hormone out of the bloodstream. So now you're hypothyroid. So all of this can lead to polypharmacy. I mean, you get on Zoloft, you get on Prozac, and then now you're probably going to get on thyroid hormone medication, and all of those kinds of things can be prevented because and so now you've racked up how many prescriptions are you on per day, and you're not even 25 years old yet. And so look at the cascade of doom, if you will. Now it's just like you're going to be spending all your money. You're not going to go to the movies. You're going to go to the pharmacy. So
speaking of that, the fastest growing number of antidepressants that are prescribed for kids are 5 to 11-year-old. It says basically there's almost 13% of them, and then kids 10 through 12 through 17, approaching 20, but are prescribed some type of antidepressant, anxiety, depression style medications. And that's, I've said it before and said it again, when you're talking anywhere from even at 10%, but let alone close to 20% of the population even in those demographics, and that takes all ethnic groups and all, nationalities and genders into account. That's a lot of prescriptions.
Yeah. And the thing about it too is, and you're kind of looking forward, but these are the people that are going to be leading our country.
Mm-hmm.
These are the people who are going to be leading our country. And I'm not going to be here. I'm going to be dead. But my son and my grandson, hopefully they will be alive and thriving. But it's one of those things where, it's just, to me, it is absolutely frightening to think because it's a fine line we walk here, but let's just get realistic. You want somebody who's running the country, you want them to be intelligent. You want them
cognitively aware.
Yes. And
functional.
And plus, you want them to be appropriately aggressive. You want them to have a thorough understanding of the world, if you will. And so, to me, that's just frightening because there's, when you get right down to it, there really aren't too many safe spaces when you're out there dealing in the real world.
No, there's not.
And it's just like, and I could just see myself, this, just like, I don't want to do that surgery because, the statistics are bad,
mm-hmm.
and it doesn't have a high level of success, and it could go on my record and that sort of thing. I don't think I'm going to do that surgery. I think I'm going to go to the safe space. It doesn't work.
Let me get them tonsils out.
It just doesn't work. No, it does not work.
Yeah.
You're gonna have to. For me, I'm a big proponent of going look, if there's a mental problem, there's a real mental problem, let's get to it and let's fix it. But if there's not a mental problem, don't act like there is. Don't act like there is. And let's say okay, what is it that's causing you to do whatever your behavior is? And sometimes it comes down to the point of just you're going to have to get yourself in order and you're going to have to step up. Pure and simple. And there are going to be a lot of people who don't like me, but that's okay.
Well, that is the case sometimes, but many times,
Yeah.
it could be chemical imbalances. I've seen that many times and seen people go on medications for a season with the understanding and the approach, because I've been involved a couple times, where the approach is get on the medication, use it for a season, monitor it, and then work yourself off of it. And it's worked. I give those doctors kudos. They said that would be just as easy to keep them on it. Tell them, but if it's not needed, it's not needed.
Yeah.
If it is, it is. There's a season for everything. And, sometimes some people just have to, that's the only way they can do it, unfortunately.
Yeah. And the other thing too, I did want to bring up the pill again, is the fact that it's definitely causes inflammation in the body. Mm-hmm. And there's people that are on birth control, hormonal birth control, have elevated levels. In studies have shown they have elevated levels of what's called C-reactive protein, which is a biomarker for enzymatic activity. And you get into a vicious cycle with the pill because again, this is another whole set of drugs. Because it can cause inflammation, and when it causes inflammation, it causes the adrenal gland to release cortisol to take care of the stress and the inflammation. And then you keep pounding the body with synthetic estrogen, mm-hmm. and then the adrenal is responding by putting out the cortisol to respond to that. And eventually what happens is that the adrenal gland just becomes fatigued. And the other thing too, it increases what's called cortisol binding globulin, which again binds the cortisol. And so you've got decreased production of cortisol, and the cortisol that you have in the body is not being used because it's bound and it can't be used. And so now you're in a whole thing of adrenal fatigue. That's a whole new set of symptoms. That's a whole nother problem. Wow. That leads to, and these are life-threatening issues when you get into adrenal insufficiency and all that sort of thing, and the drugs related to that. Mm-hmm. So now it's now you're on the pill. Now you're being treated for hypothyroidism. Now you're being treated for adrenal fatigue. Now you're being treated for high blood pressure. And it just goes on and on and on. And you didn't need to be on any of it. You just didn't need to be on any of it. And so, to me, that's just ruining your life. And you may not even know it. And so, for me, what I would like to say to my colleagues in OBGYN, I understand your workload. I really get it. But I do think that when these people, especially young females, I mean, we're talking about 12, 13, 14.
Oh, yeah.
You know, when these, you know, come into your office, they need a thorough screening, because just think if they're already have some underlying disease like depression or something like that, and you put them on the pill, and then they commit suicide. So all of these things are very real and have to be dealt with. And so I'm just going to say to my colleagues, look at the latest literature and understand that these birth control pills in many cases are associated with some severe forms of psychological illness up to the point of being suicidal.
Wow. You would never think that or know that. And I'm sure most parents of girls, females, biological, would, you know, probably do not know that information.
No.
You know?
And you could say like, oh, well, you know, you're only addressing, you know, a subset of the population, but realistically, think about it. How many people would 100 million women affect? You know?
I mean, come on, effect.
Well, if you're the guy that's in the passenger seat of the car that drives into the oak tree,
it only takes one.
So you've got a problem. But I'm just saying, like, for 100 million women to be affected by this, and look at the care that the women are supplying to their families and that sort of thing. And I mean, this is a big deal, and it's overlooked. And it's again, we always go back to this healthcare. There's physical costs, there's mental costs, and there's financial costs. And it's just like, if you look at just that birth control pill segment of population, how much money is that? Not to mention the physical and mental suffering involved. So that has to be effectively dealt with, and I don't think it is right now. Right. And it needs to be looked at a lot more carefully and cautiously than it is. And I understand why. I get it. I really do, because I've been there. But you've got to pay attention. I think you have to pay closer attention. And every woman that's put on a birth control pill, and especially if it's a minor, all of these kinds of things need to be discussed with the patient and their parents or their caregivers.
Wow, yeah, absolutely.
Mm-hmm. So I could go into a lot more that whole thing of the pathways here and the pathways there, and people would just start throwing things at us if they could.
Yeah. I really am not being able to sleep tonight, honey. Oh, put that podcast in. Flip it on YouTube.
It'll put you right out.
Yeah.
But you know, we have to have these every once in a while. But yes. I feel like
it's an important subject.
Eventually, we get to the to what we're supposed to be talking about.
Yeah.
You know?
Well, I'm going to cover the colleges, you know, and then some of the ways in which people can actually, as you were saying, can actually help in those situations. But you know, with college students, I'll make this, you know, it's pretty simple. According to the American College Health Association, which did a study in the spring of 2023, 76% of all undergraduate students reported either serious or moderate psychological distress. And then a current one as of March of 24, which is US News, their Generation Lab, they call it, put out findings that 70% of all college students, I thought it was in the 40s, so I've been misquoting that. 70% of all college students are struggling with some type of mental health problems, which is an increase of over 50% since 2013. That's a lot, you know, and that's why they have their safe spaces. That's why they have, you know, the easiest thing to do is just stick them right on, you know, medication. So when you're looking at demographics, and like I said, the stresses are their time management, their debt, you know, they spread themselves too thin. They've already got anxiety and depression, which that exacerbates relational problems. You know, they're trying to choose their career path and their academics, and you don't know what their socioeconomic background is. It could be a geopolitical background for some reason, depending if they're a foreign student. So there's a lot that goes into that. And, you know, the majority of them are, I think the highest percentage currently, you know, it's some type of depression. and then next follows by anxiety, and then you have those who get to the point, like Steve said, they could get to the physical point of this where they're doing cutting, they're doing all kinds of things, beating themselves, putting themselves in risky situations, harmful situations, purposely, just to try and take their mind off or try and alleviate that stress. And that's really, it's kind of a sad thing when you figure that over half the college students walking on campus either are or going to be or will be on some type of mental health medications. And you don't know what medication, because sometimes, as you know, it's not just one medication. They have to take a medication. Oh, it upsets my stomach. Well, let me give you this medication. Yeah. Oh, it's giving me whatever. Here's some potassium pills. Whatever the case may be, it's like I said, it's a multi-billion, multi-trillion dollar, and we're not coming out to say that that's wrong for people to get medicine, but people just need to do more research. And as a college student, if you're a parent, caregiver of a college student, or an elementary, from kindergarten up, as it looks like they're popping out these drugs, you really need to do a deep dive and do some research. That might be a pain, but it may save you some anguish, some time, some money and energy down the road, and some heartache. Because like I said, when people have said, and it doesn't happen 100% of the time, but there are many times I think that, as Steve said, there are reasonable ways to handle things that people might say, well, I think they really got, they're struggling, got some issues. Sometimes you just have to deal with it, and we have to teach them coping mechanisms to deal with it. And I think that's a lot of times where we fall short as parents and as school teachers, counselors, all that falls short of helping them to work out and have, if they will, standardized coping mechanisms, and make that the first thing that we do, instead of saying, well, I'd go see their doctor because I really think that maybe they need on medication. Because that's what most parents are going to do. Okay, we go to get that taken care of. But, and how you cope with that, if you don't mind me covering some of those areas.
No, I'm just sitting here listening intently, but I will say this. Yeah. When I was in medical school, and we would have like, and I'm sure again, I relate a lot of med school surgery with like military, because you're put under a lot of pressure, stress, duress, whatever you want to call it. But I just remember in med school we would have like, okay, next week begins test week. Mm-hmm. And so it's like every day for like 7 to 10 days, you would have either 1 or 2 tests. So I never got any kind of inflammatory or any kind of blood work done, or nor did anybody else. But what would your anxiety levels be on something like that when you're staying up like all night studying, all the time? And you would study and be prepared for it, but then you'd stay up all night just because you think like, well, that's what I'm supposed to do. Because me and my friends are staying up all night, and you just stay up the whole time. And then when you're finished, like once test week to 10 days are over, it's like we didn't take any Ritalin, or we just took beer.
It's a different world now. When I was in the Army and wore that big pager, there were no cell phones really out for general use. Mm-hmm. These just giant pagers that just beat these 4 little lines across, little red lines. You had 30 minutes, you had to be on base, ready to, as they would say, grab your gear and move your rear. And I'm telling you, when you would get that pager would go off, you didn't know if it was a drill. You didn't know, as sometimes, if we were heading to do things in other countries or somewhere. So it was always, to me, later on in life, I'm thinking, that little well, it wasn't little, those pagers were the size of a cell phone, but it's on their side. You thought you were
kind of like a speaker.
Yeah, literally. Yeah. All it is goes, and but you didn't know where you were going, what you were doing. So there were a lot of guys that would be, it'd be, 40 degrees out. You show back up on base with all your gear, and they're just sweating away because of the anxiety of having that pager on them, knowing that at any minute, you could get called. In the 80s, the early and mid 80s wasn't the best time in the world. We had, several things going on. So, but as you said, but there are a lot of ways. One obviously is when you get notified, or if someone suggests friend, school counselor, teacher, anybody. I'm not saying take it with a grain of salt, but you need to first speak to the person, see what's going on. If it's your child, if it's a friend that somebody wants you to talk to, and find out and delve into the root issues. And then maybe it's something where you do need to go see a medical doctor, and then insist that that medical doctor actually get you with a qualified counselor. And there's gonna be some people that send me hate mail. I'm fine with that. I'll just trash it. After I laugh at it. But get with a qualified counselor who can deal in those areas. If it's a child, you want somebody that deals with children. You don't want a general person that just deals with everybody, because there's specific needs to little kids that, you know, a lot of adults don't necessarily cope with, that maybe the counselor's not the correct person. You know, healthy eating, as Steve and I say this a lot, healthy eating, exercise, your social environments, and COVID really had a rough time and really brought out a lot of mental health problems because of that, you know, and because of the isolation and you know, the people falling back and, you know, in skill sets and everything, and educational skill sets as well. So you can look at joining groups. There's a lot of ways you can get into things. You can get into with local churches, whether you're a member or not. A lot of churches have, you know, from college age all the way down to elementary, they have youth programs and programs. They're not going to Bible thump and browbeat you, but they're great programs to get into because you have community, you have a safe space, if you will, you have peers that you can get to know, make friends. You can find a lot of people probably struggling with the same things you are, even if it's children, and just kind of and monitor it from there. You know, and I will also say one of my favorites is, and to talk about, and I tell people about this, is what Steve and I are big into, and that we actually are working with, you know, a major hospital organization to bring about the making this, is it usual and customary?
That's correct.
Okay, I got it right for once. Usual and customary for art therapy.
Right.
Because art therapy is one of the #1 things that counselors use, which I was shocked at until I know this. You think I'd already know this. To help deal with anxiety, stress, depression, mental, not necessarily if it's severe mental illness, if it's mental illness, because those are release mechanisms, and that creativity releases those endorphins, you know, gives you a sense of purpose. And so art therapy is, you know, and there are a lot of art therapists out there. So, I mean, not a ton, but there are a lot out there, more than there used to be. You can usually find them through either the hospitals that you may know in your area, or you can actually contact your local hospital, say if you don't offer them, do you know anybody that does? They will give you guidance in your area that someone may do that. It could be a private practice, could be, like I said, through a hospital chain. But those art therapists can help work out a program for counseling and to oversee at the same time. One of the things is why we're so big on this is because of our art therapy. You know, we're starting to help fund and bring about a positive change by doing the studies for art therapy, to cut down on cost, to help with patient care as far as healing, getting out of the hospital quicker, getting out of these situations. Maybe someone that's never going to get out, that can help them to make their either limited time or their long-term stays, you know, more palatable, so that they can you know, have a way to have a release so that they're not so lonely. And so one of the things Steve and I do is we have which I didn't tell I was going to talk about this, but I am. Today, Steve and I have a blockchain company along with our art gallery also, and we use a lot of that because of medical tech. Steve's background, some of my background dealing with these tech teams and stuff for blockchain and smart contracts and everything. But we actually have that social media platform we did. That social media platform is actually converting also into an art therapy app, where people can go on and track their moods. They can set up counseling, online services through their local communities for art therapy, and find ways to maybe use art therapy instead of using medications. And you know, it just makes for an overall better community because you have coping mechanisms. Because the easiest way, and again, I'm not knocking this on people, but big pharma and big healthcare would love for you just to simply do Insurance isn't thrilled about it, I'm sure, the industry. So you can support Dr. Steve and Frank, at any time if you'd like, because we're on your side to help cut costs. But art therapy, as we've talked about, that could save well over $1 trillion over a 10-year period, if not multiple trillions of dollars, because we did the most conservative way when Steve did his modeling.
Art Therapy Healthcare Savings Model, presented by Williams Snodgrass Art Gallery. The most frequent diagnoses for hospital stays are septicemia, heart failure, osteoarthritis, pneumonia, diabetes. The average cost of a hospital stay per day in the U.S. was $2,883. Kaiser Family Foundation, 2021. For 36.4 million patients, the average length of stay, LOS, in the hospital ranges from 4.5 to 5.5 days. Also, the average length of stay, LOS, in the hospital ranged from 4.5, Hospital View 2023, to 5.5 days for 36.4 million inpatients. National Center for Biology Information, National Institutes of Health, 2018. Pain reduction from non-medical sources, such as art therapy, is associated with a savings of $898 per admission. Art therapy has been associated with decreased length of stay, as well as decreased pain and sleep medication requirements. For example, an average LOS is 5 days. This means that the average cost of a 5-day stay is $14,415. 5 days length of stay x $2,883 cost per day equals $14,415. Comparatively, if we were to reduce the LOS by just 1 day, the average cost of a 4-day stay is $11,532. Considering there are 36.4 million stays each year, this equates to a savings of over $104 billion per year. 5-day LOS. Average cost, $2,883 per day x 5 days x 36.4 million people equals $524,706 million. 4-day LOS. Average cost, $2,883 per day x 4 days x 36.4 m people equals $419,764,800,000. 1-day LOS. Average cost, $2,883 per day x 1 day x 36.4 m people equals $104,941,200,000 equals $104.9 billion. Now, pain reduction by non-medication means is associated with a cost savings of $898 per hospital admission, which gives an annual savings of $32.6 billion per year. Together, a 1-day decrease in LOS plus savings in drug costs amounts to a reduction in healthcare totaling $137.6 billion, $137,628,400,000 per year. 10-year savings projections are then $1.376 trillion, $1,376,284,000,000. Art therapy may significantly reduce healthcare costs and improve patient outcomes as well as quality of life, and should be offered as part of usual and customary care in both inpatient and outpatient settings, covered by Medicare, Medicaid, and private insurance.
So if you're walking around and you've got a society that's heavily medicated or medicated versus a society that finds coping mechanisms and ways to deal with things through therapy or whatever works for you, then overall the community and society is going to be better. You have more well-rounded people. If things come up, they're more able to handle it, because otherwise, what I've witnessed before, until somebody pulled their child off and found out, and not saying this for everybody, but found out after having their child in that rhythm for a couple of years and they were a zombie. Maybe and they didn't have them on 2 other medications to counteract that medication. And then finally after 2 years, the mother said, I'm done. I'm done. So, my wife and I just kept talking to him saying, I'd really consider pulling that off, maybe get a different counseling, and so that's what happened. The kid's the most normal kid that you would, well, as an adult now, but the most normal kid, well-rounded, coping mechanisms, has a slight learning disability, but, other than that, doesn't let anything stop him, is very determined. But at that time, for those couple of years, literally they were zombified. And that was just so sad, because that kid was missing quality of life. As you can tell, I'm kind of passionate about this because of being a child advocate. Steve is too, because, not that we're against big pharma, big healthcare, but enough's enough when you're trying to push this out. It's kind of like, I won't get into COVID shots, so we'll leave that for another day.
That's another day.
Yes, but when we decide at some point for big pharma, you're going to know you're going to know somebody.
Well, my wife, again, she's been a pharmacist for,
yes, no slave to her. Mary, I did not say this.
About 4 decades, but she's got a talk that is so poignant and thought-provoking. But and I've seen her, I watched her practice on it, but a long time ago, I'm talking in the 50s and 60s, that sort of thing, when people would say, like, they'd go to the pharmacy and they'd pick up their medication, they would get a sack. They get a sack.
Yeah.
And then all of a sudden the sack becomes like 2 sacks.
In a bag.
And then it becomes a box.
Yeah.
So it's like now it's a box of drugs. And I look at, I've got relatives that are on like 13, 14 drugs, something like that. And I tell them, like, hey, you can kind of control some of that. Let me go through that with you. And that's well, my doctor's, I'm good right now, and that sort of thing. I was like, okay, I'm not gonna go there. So because if something happens, it's like, well, he was fine until Steve got him off the drugs, and then and now he's dead. So
yeah.
So
I didn't like him anyway. No, you can't say it.
So it's,
I wasn't in the will.
So I don't want to get involved in it. Like I'll make an offer that, because when you're the only doctor in the family, I mean, you really get hit up a lot.
Sure.
Yeah, you get hit up a lot, and that's fine. I mean, it's just part of it. But I mean, most of them, they don't do what I tell them anyway.
Yeah. So, well, like that art therapy, it increases your this is from the American Congress of Rehabilitation Medicine.
Okay.
And it says that it increases serotonin levels, increases blood flow to the part of the brain that's associated with pleasure.
Yeah.
It fosters new ways of thinking. It makes your creative thinking processes come out more. It helps you to, for whatever, I imagine it's part of serotonin on that, but it helps you to imagine a more brighter future. It helps your overall well-being, which increases your quality of life. And it even helps with interpersonal relationships and freedom of expression. And there's a bunch more, but that's just some. So, we're not saying that's the cure-all, but there are a lot of alternatives to just drugging people up, as Steve said.
And then one of the things too is art therapy. We can differentiate a little bit. Art therapy is basically, there's psychotherapy associated with creating art, and all that's what we are striving to do, because we know, I can tell you, from my own personal experience, I've got physical issues in my own body, and then when I paint, I'm pain free. I don't dwell on any
Take your mind to another place.
Yeah, you are completely, really in another world. And then for like 3 or 4 hours, it's pretty incredibly wonderful. And just so, if you're on chemo or anything like that, I've read many, many times about cancer patients creating art, that sort of thing, and how they were sick with chemotherapy and depressed and all that sort of thing. And when they created art, they didn't have any kind of pain medicine requirement. They didn't have any nausea. They didn't have any vomiting. They created the art, and they felt really great about it. And so one of the things I'd like to challenge everybody to do is to create a piece of art. And they're going to say, like, oh, well, that's just the stupidest thing I've ever heard of. But realistically, I did it. I did it. I was like, and I told you for
out of the blue.
I said, like, one of these days, I'm going to take all of these motions I've learned and all of the knowledge that I have, And it doesn't, you can look at one of my paintings and you may think like, well, what is left to the beholder, right?
Yes.
But anyway, there's so much thought that goes into that, and it's just like, I can do like this painting, I do this painting with knives and sticks, and I can look at that painting, and it's just like, to me, I see it so clearly, and I'm just going like, that needs another dot of paint right there. And just like, well, I wouldn't think that, but you do. So, again, and then when I sold my first piece of art, it was like, it was indescribable. It was so good. Because you think like, you sell this paint, you create this painting, number one. You think like, well, am I gonna just make a complete fool of myself? And the answer is probably yes, but it's okay. It's how things get done. And so I did it, worked very hard to get gallery representation, and then my paintings have sold incredibly well, thankfully. But there's nothing like creating art and then selling art, which is why we created the gallery. Because it's realistically, it's almost impossible to get representation. It's almost impossible.
It is, and you'll see the link on our channel and all here for the art gallery we have.
And when you do, a lot of times it's like the artist, by the time it's all said and done, there's really nothing left. It's like starving artists.
Right.
They
I've
that
seen a lot
saying
of
for
those,
a reason, But I would like for everybody to create a piece of art, submit it on our art gallery, see what happens. I mean, it can be life changing.
It can be, yes.
It can be.
I know your story.
Yeah.
And I'm waiting for it because art takes me away. The only time because I can get a little frustrated whenever I take the paint and I can't get it in where the numbers are for the paint by numbers.
Well, it's that's
what straitjackets are for.
Hey, it's still creating art.
Mine's more like the Three Stooges painting.
But I feel like for me, this has completely changed my life. I mean, it really has.
Yeah, and it's simple. It's just WilliamsSnodgrassArt.com.
Yeah.
And like I said, I'll have the link and just take a look. We give you guys, we're not trying to hack this. We just got into this conversation. But, as an artist, or even if you don't think you're an artist and you want to try something great, or your kids do, it's just a simple process. It's probably the simplest process to sign up and start listing art on because we have a global presence and we advertise. We've got over 1 million followers on our Instagram account, and between that we have a lot between all of our social medias, and we'll put your stuff out there in front of people, and like Steve said, it can be life-changing. I've seen things that that I thought that's never going to sell, be gone in an hour, be gone in a week, and people were like, I can't believe that somebody actually wanted that and would pay that money for it, so you don't know until you try, and that's whether it's paintings, whether you do a sculpture, digital picture, NFTs, whatever it might be. We've got an area for it, and you will definitely get the audience for it. And so,
and just go for it. Just go for it, because the art therapy is one thing, and then creating art is that's kind of another thing, because you don't have a therapist involved. But either way, it's like if you're in the hospital and you create art, you have art therapy, that sort of thing, and it's like, what's done with that art? A lot of times it's just thrown away. But to me, that can be some of the most impactful art ever.
You don't know
created.
who, complete stranger, family member, may want a piece of a memory, or may just get an emotional response and want that. The neat part about it is we don't charge you anything other than the basic submission fee as you start actually physically listing, which is like $5. Other than that, whatever you ask, if you ask $100, you ask $100,000, you get that 100% comes to you.
Yeah, when they buy it, it comes to you.
Yep. Once it's confirmed and done, it's automatically released to you.
Yeah, and I think that for me, just to create the paintings, I'm hoping, like, there was a great video of Picasso painting when he was like 90 some odd years old, and he was just absolutely loving life. And it's like, that's pretty good. It's pretty good. But I'm hoping that that people will get involved in this program. We make art therapy part of usual and customary care, and then we take it one step further by actually selling that art, and that will I guarantee you.
And part of our proceeds that we receive, because the gallery has a small commission on, but we donate that and partner up with organizations to help fund studies, to help fund art therapy programs, and because a lot of times art therapists are paid, they're self-funded through those hospitals. So by people doing that, and we encourage you to get involved with the gallery, and you'll be gallery represented, and we're no slouch. You're actually helping to fund other people who are going through suffering, because the art therapy programs are allowed to expand, and with new and creative programs, and also help fund those art therapists who are going to school and may encourage others because of scholarships that may be available.
And at some point, we'll make these announcements that we're going to be working with one of the premier, most respected,
largest,
medical university hospital systems in the world.
Yes.
And we're going to be working hand in hand with them in regards to the art therapy and just creating art, because we want, they have a lot of employees, and they have a lot of businesses they're associated with that have, just like very close to them, several 100,000 employees. And we want those employees to create art, because it does something for their mentality as well. It's just a great outlet. It's a great outlet, and it's underused, and it's people just don't think of it like, well, if I paint a painting, what's that going to do for me? I'm just going to get ridiculed. No, try it, see for yourselves, because there's no feeling.
Don't leave it out in the sun too long, because what I found is the paint will sometimes get melty from the sun, and then the numbers shine through.
Well, I went out, I did a painting. I won't go into it too much, but I did a painting, and I paint outside because my paint gets everywhere. And the skies were as blue as they could be, and there was no rain in sight on the radar, anything like that. And I said, okay, I'm finished with the painting. I'm gonna go do a bike ride, and I'll come back in a couple hours. So I come back, and I see there's puddles on the streets everywhere. I'm going I got a painting out. But I went out, and the painting was wet, and then it dried, but it dried to the point of it dried to the point of being so cool. There's no way I could have created it. And I showed it to a couple of people. They're going how did you do that? And I said, it's kind of a secret sauce.
Yeah.
It's just well, really, it got rained on. And then it dried like that, because they said well, it looks like it's in the fourth dimension. It's unbelievable. And it really did.
Is that the one? You sold that pretty quick, didn't you? Is that the one?
No, that one's not sold yet.
Oh, you own that? Okay.
That's a special collection. But anyway, it's one of those things where, I thought it was going to just be completely
special edition.
Yes, exactly. There's some people that might say that. But anyway, that's it. But I want to go back to all of this, and again, how many times can we say it? But it's never been more true. It's never been more true, ever, that you have to be your own advocate in everything. I'm talking about how many times have you seen when people say they're going to go buy a new car, and they're going to go talk to the car salesman? I hate to even say it, but everything is almost like that anymore. It's you have to be aware of what's going on. You have to have informed consent of what is the true picture. If you don't, you're going to get slaughtered. That could be your broker, that could be your financial advisor, that could be your doctor, that could be your car salesman, anything. You
could be your hairstylist.
Yes, absolutely. But you have to be your own advocate.
That's true.
And we have just said that, and we're beating it to death, but we're beating it to death for a reason, and that's to keep you from harm. Yes. We want to keep you from harm.
We're here for you.
Absolutely.
Well, we thank you, and we look forward to the next podcast. Hope you enjoyed it.
Yeah, I hope you had a good time with
us. Yes. Stay healthy, stay safe.
See ya.
Thanks for listening to the DrFrankenSteve podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.